Hello and thank you for joining me today. I'm going to be telling you a little bit about night terrors. Most people think night terrors are something that only affect young children, but the reality is that a lot of people suffer from night terrors well into their adult lives. I suffer from night terrors. I have since I was 14 years old. When I'm having a night terror, my eyes are open and I'm talking perfectly normal, but none of the things I'm saying are making sense because my brain is still really confused. They always start with me thinking that I saw something like an animal or a shape in my room, and it's always just a shadow. It takes me about 5 to 20 seconds to realize that the things I'm seeing aren't real and that I'm just making it up. I can always fall back asleep right away because I'm so used to having night terrors, but I always have to sleep with a light on, otherwise I would have like 3 or 4 night terrors a night. Night terrors can have a hugely negative effect on your life if you don't find a way to cope with them. Today I'm going to be telling you about the causes of night terrors, the symptoms of night terrors, and some treatment options. Let's start by talking about some of the causes. Though night terrors are not completely understood, there are many different causes of them. Genetics can play a big role in night terrors. According to the conference paper Annals of General Psychology, Volume 5, published in 2006, 27% of people who have night terrors have a history of them in their family. I know this is true for me because my dad has the worst night terrors of anybody else that I know. There is definitely a strong correlation between night terrors and sleepwalking. The American Journal of Psychotherapy's journal entry, Psychotherapy and the Night Terror Patients, claims that night terrors and sleepwalking patients share many clinical characteristics. It's not uncommon for people to have both conditions. Both are caused by sudden arousal from NREM stage sleep, or non-rapid eye movement, and they usually start within the first 2 hours after you fall asleep. People who suffer from night terrors have a higher incidence of suffering from anxiety or depression. According to the International Psychiatry, they say that night terrors and other parasomnias occur repeatedly in 18 to 45% of people who have panic disorder. Other triggers include stress, lack of sleep, a new environment, or sleeping in the complete dark, or any mix of those. So what actually happens when someone has a night terror? There are pretty specific symptoms, and they are not the same thing as a nightmare. Many people think they're a nightmare, but they're not. A nightmare is a completely mental experience, whereas a night terror is mental and physical. Physical symptoms include rapid heartbeat, sweating, an appearance of being awake and talking. Mental symptoms include fear, confusion, and irrational thoughts. Anxiety over night terrors can cause insomnia, exhaustion, irritability, headache, and many more problems. Finally, there's a few things that can be done to control your night terrors. Some are easier and some are a bit more drastic. There's a drug called diazepam that has been proven to suppress slow wave sleep and to lower the frequency of night terrors, but doctors aren't sure if the effect of it is because of the slow wave sleep or if it's because it's an anti-anxiety medication in the first place. Another drug is imipramine, and it's thought to reduce the frequency of night terrors. The American Journal of Psychotherapy, though, says its effectiveness hasn't been demonstrated in any controlled studies. There are some lifestyle changes you can make to alleviate your night terrors before you take any medical interventions, like getting enough sleep, sleeping with a little bit of light on, or even like a white noise machine, a fan or a humidifier helps me. Coping with stress and talking to a therapist or a sleep counselor are also ways that you can alleviate night terrors. So as you can see, a night terror is more than just a nightmare. And I think that pretty much covers the basis of what I wanted to tell you today about night terrors, how there's many causes. A night terror is not the same thing as a nightmare, and the few steps that you can take to alleviate your night terrors. Thank you for your time.